Hi, my name is Tufik Kabbani. I'm a clinical and research fellow in celiac disease at Beth Israel Deaconess Medical Center in Boston. We were invited by the editors of Gastroenterology to review the findings of our paper entitled Patients with Celiac Disease Have Lower Prevalence of Non-Insulin-Dependent Diabetes Mellitus and Metabolic Syndrome. Now, some background information. As you all know, celiac disease is associated with autoimmune diseases such as insulin-dependent diabetes mellitus and Graves' disease. However, no studies have been conducted to explore the association between type 2 diabetes, also known as non-insulin-dependent diabetes mellitus, and metabolic syndrome with celiac disease, despite the fact that these two conditions affect far more patients than insulin-dependent diabetes mellitus does. In addition, type 2 diabetes and metabolic syndrome are associated with significant cardiac as well as non-cardiac mortality and morbidity. Therefore, we conducted this study to examine the association between celiac disease and the two conditions, and to explore any potential modulatory effect of the gluten-free diet on the incidence of diabetes in age later on. In total, we looked at more than 800 charts of patients with biopsy-proven celiac disease, and we reviewed their charts for type 2 diabetes, hypertension, and hyperlipidemia. In addition, we accessed their charts for BMI measurements, blood pressure measurements, lipid profiles, and glucose levels, as well as glycosylated hemoglobin to identify those with metabolic syndrome. 840 age, ethnicity, and gender-matched controls were selected at random from patients who presented for primary care visits at BIDMC. We conducted a multivariate analysis to control for the effects of BMI, age, gender, and ethnicity. In addition, we conducted a Cox regression analysis in order to identify any hazard effect of the gluten-free diet or making the celiac disease diagnosis on the incidence of non-insulin-dependent diabetes mellitus. Our results were really interesting. 3.1% of the celiac subjects had non-insulin-dependent diabetes mellitus compared to 9.6% of the controls. This was statistically significant. Similarly, the prevalence of metabolic syndrome in the celiac cohort was significantly lower than that of controls. Despite the fact that the mean BMI of celiac subjects was significantly lower, the negative association between type 2 diabetes and celiac disease persisted on multivariate analysis after controlling for BMI, age, gender, and ethnicity. The results of the Cox regression analysis also revealed that starting the gluten-free diet may be protective. However, the value was not significant. This might be attributed to a lower N, since only 5 celiac subjects had their diabetes diagnosis after they started their gluten-free diet. In conclusion, the prevalence of type 2 diabetes and metabolic syndrome are significantly lower in celiac patients compared to controls, as well as the enhanced population. Possible mechanisms involve genetic factors, personal behavior, as well as pancreatic dysfunction. Future studies that confirm these findings are needed, as well as studies that explore the mechanisms by which celiac disease affects the risk of type 2 diabetes and metabolic syndrome.